Pretest probability, brought to you by Testing Wisely. When doctors are considering ordering a test, it is helpful to follow the 3 Ps framework. The first P is to determine the pretest probability of diseases. While many diagnostic tests perform well, none are perfect. To interpret the result of a test and properly diagnose a patient, clinicians must first understand pretest probability, or the chance of disease in a patient before testing. Pretest probability is determined by comparing the incidence or prevalence of disease in the general population against patient-specific factors, such as patient history, symptoms, and findings on physical exam. Let's determine the pretest probability for a patient being evaluated for a heart attack. Incidence. Mrs. Mendez, a 43-year-old woman, has chest pain. The incidence of heart attack for women her age with chest pain is less than 1%. Patient history. Mrs. Mendez reports crushing chest pain and shortness of breath. Probability increases to 15%. Mrs. Mendez says the pain is unchanged from the past month. Probability drops. Physical exam. On a physical exam, the pain is reproducible with pressure on her sternum. Her final pretest probability is around 4%. Let's determine the pretest probability for a patient interested in HIV testing. The prevalence of HIV is around 1% in the US population. Patient history. Mr. Burke has had unprotected sex with men. Probability increases to 10%. He adds that he has not been sexually active in the past year after a negative HIV test. Probability decreases to 0.1%. Mr. Burke reports recurrent pneumonia and on physical exam appears thin and has lost 20 pounds. Probability increases to around 2%. When bringing together all of these factors and considering different diagnoses, it is helpful to remember an aphorism. When you hear hoofbeats, think of horses, not zebras. Both beginning and experienced clinicians often overestimate the pretest probability of disease, from infections to heart attacks to cancer. Testing when pretest probability is low can lead to false positives. Testing when pretest probability is high can lead to missed cases or false negatives. However, if doctors combine the information gathered about disease prevalence, patient history, and physical exam to determine the pretest probability, they can make more informed decisions when ordering tests and interpreting test results. The sweet spot to consider testing is when pretest probability is in the middle. The pearls to remember when approaching pretest probability. The pretest probability is essential for test ordering and interpretation. Base the pretest probability on incidence or prevalence, history, and physical exam. Probability varies with information before a test, pretest, that is then adjusted by test results. Visit www.testingwisely.com to learn more.